And this morning, we're taking a closer look at how public health systems are dealing with gun violence, just days after the U.S. Surgeon General declared gun violence a public health crisis. Dylan Valencia spoke to local doctors and advocates to learn how they're changing the conversation surrounding gun violence. Good morning, Dylan.
Yeah, that's right. Good morning, Manny. Well, local doctors are starting to look at gun violence as a health issue after the U.S. Surgeon General made this announcement. Now, I sat down with a local medic plus a member of an advocacy group called On Call for Kids, which is comprised of doctors that take a stand to change legislation regarding gun safety. Take a look.
We have now reached the point where gun violence is the leading cause of death among kids and teens. The leading cause of death. That is something that we should never take as the new normal. There's nothing normal about that.
So this is an issue that we're obligated to speak out as doctors, again, because it's the leading cause of death in children.
Dr. Deanna Behrens works in an intensive care unit in Illinois. Having seen the impacts gun violence has on families, is taking a stand with over 100 other doctors to bring change to gun legislation, saying doctors should play a role in gun safety the same way they are involved in other types of safety.
People say that this is something that the medical community shouldn't get involved in because we're involved in a lot of things that help reduce harm in kids.
These doctors, a part of an organization called On Call for Kids, which just months ago, over 80 doctors visiting Capitol Hill.
We advocate for 3 specific laws. The first law is a safe storage law. And we also really encourage parents and everybody, if they have a gun, to keep their guns locked with the ammo locked separately.
The second and third laws being to advocate for a federal assault weapons ban and universal background checks. Local Mercy Health doctor Matt Smetana has worked with gunshot victims on several occasions.
Every time I see a gunshot victim, I know that there's going to be ripple effects. Whether that's oftentimes the patients have life-changing injury patterns, but I also understand that there's going to be effects on the community that witnessed these acts, the family of the victim.
Which is why him, along with other doctors at Mercy Health, are having conversations with patients on the topic.
It's important to talk to patients about unintentional access to firearms. One of the ways we can help curb some of this violence is making sure that firearms are stored properly and we're preventing or limiting access when it's not intended.
With him being a part of their MD1 program, where actual doctors respond to scenes where gunshot victims need immediate attention.
When children are victims, obviously whenever kids, pediatric patients are involved, that brings an extra level of stress when you're responding to an event or when you're taking care of a child who's injured.
And Dr. Behrens is encouraging parents to sit down with your children and teens, talking about the dangers of tampering with guns and on the overall topic of gun safety.